Hello, everybody. Today, I thought we'd put together just a short podcast to follow up on something we discussed at length a while back when we had Judge Linda Clark on our cast. We talked about what's called the opioid epidemic, and we talked to her about some of the efforts that are being made in her court and some of the organizations that she's involved with, Families Against Narcotics, Hope Not Handcuffs, that sort of thing. I hope you had a chance to listen to that podcast. If you haven't, I encourage you to go back and give that a listen. It was really interesting to hear from somebody so involved every day, dealing with folks, not only folks who are dependent on opioids, but also families. But one of the things that we talked about in that podcast was some legislative efforts that were coming to help curb the use of opioids. Well, since that podcast was completed, in fact, here in Michigan, effective July 1st, there is a new law that prohibits doctors from prescribing more than a 7-day supply of opioids for patients who are in acute pain. That was something we talked about in our podcast. At that time, it was just a proposed law. It is now in effect. So I thought I would revisit that. And in doing that, I was looking at some other things and realized that this is not necessarily such a cut and dried issue. You know, if you listen to the podcast, if you haven't, I would tell you that one of the things that Judge Linda Clark said, at least I recall her saying that ideally they would like to take that number from 7 days down to 3 days. And I think it's pretty clear to see the intention behind that kind of effort. The longer people are on opioid medication, I think there's a greater likelihood that they're going to become dependent and have subsequent problems, maybe related to addiction and overdose and all of that sort of thing. So I think we can see the intention behind it. But as I say, it's not all cut and dried. I have talked to several other people about this issue, and some of them were in favor of it. Some of them were not. And it so happens, I read an article today in the Detroit Free Press, and this is sort of what prompted me to record this cast, but I read an article today in the Detroit Free Press about a young lady. She was 28 years old and originally was given opiates following gallbladder surgery about 4 years prior to her death. She died in February of this year from a heart infection that the doctors believe originated with a contaminated needle that she used to shoot heroin. And the article goes on to say that she started using heroin when she ran out of her prescription pain medication. And when I talk to folks about limiting the amount of prescription medications made available to a 7-day supply, or even a smaller number, 3-day supply, for example, or even a 30-day supply for that matter. One of the arguments against it is that when people run out, they will then look for other ways to get that pain relief. They'll look for things like heroin, and there's a lot that can go wrong when they do that. And this article sort of backs that up. It's an article that interviews the family and talks about the path that this young lady took and how it affected her and how it affected her family and how it affected her children. And so it just made me even more acutely aware that even though there's some good intention behind this law, there is an argument against it. And, that which led me to research other articles. And I found another one that talked about a law in Arizona, and a similar law in Arizona that limits the amount of prescription opioids that are made available for individuals. So it really is something that I think is going to take a lot of thought. I had a conversation today we were recording another podcast today. We were talking about legalization of marijuana, specifically in Canada, and how it may impact the U.S. But as part of that conversation, a gentleman I was talking to, a guy I've had a guest on a couple of different podcasts now, talked about marijuana as an alternative to opioid medications, and how people with chronic pain, if they have access to marijuana, may find relief without running a danger of becoming dependent on opioids, or using marijuana to treat folks who may have PTSD. So I think there's still a lot to be learned, about opioid addiction, a lot to be learned about marijuana as an alternative to opioids, a lot to be learned about trying to limit opioids, either on the supply side. I know there's a lot of efforts made on the supply side, but also on the user side, trying to limit the amount of medications that people have access to. So it really is it's quite a health crisis. But I was struck when I was reading this article about the young lady. The article was of course, in the Michigan newspaper, but this the family that was the focus of the article was in Tennessee, and their pain really came through. Their pain of the frustration they went to, the pain of the guilt that they felt. They at one point called the police and made some effort to get their daughter put in jail, where at least they knew she would be safe, and the guilt they felt about giving her money when she would tell them that she needed money to pay a bill, and finding out maybe later that money went to using drugs, and the guilt that they felt about parenting her children, and all of that. The pain really comes through, and I recently had the experience of losing somebody who I knew, and as we talked to people that knew this person, everybody was saying rest in peace, and there were some social media posts that said rest in peace, and I thought about that expression, rest in peace. And then I thought about that expression as I was reading this article about this young woman who just was so troubled, and the sentiment behind that idea, rest in peace, and the hope. I think we say that sometimes by rote, because it's the right thing to say when somebody dies. But I think we can look at that and say we see somebody who is so troubled that we really, really do hope that they are now at peace. There's a tremendous sadness that comes along with addiction and death from addiction. But I also think sometimes there's a relief when it's over. And I think there's some guilt for feeling that kind of relief. And so we say rest in peace, and I think sometimes we don't really think about that. But I thought about it when I was reading this article. And we hope that this young lady, 28 years old, is now at peace, and her family can find some peace, some way to work through their grief and work through their guilt and come to some kind of peace. And I think that's, and again, I think the intention behind the law that I talk about that limits the amount of opioids, I think there's a good intention. I think the idea is to reduce the number of deaths from opioid overdoses. But I think there's also consequences to that kind of decision. So there is no right and wrong. There is no black and white answer. I think there's a lot of gray areas in here. And we're going to continue to monitor this. There will be other podcasts going forward where we're going to talk to people who have differing opinions on this. But I would encourage you to look a little deeper into this. I would encourage you to look into these laws. I would encourage you to look into just what the scope of the opioid epidemic is. There's some really big numbers out there. The number of people who are using, the number of people who are overdosing, the number of people who are dying. Those are big, big numbers. Look at some of the ways in which the state you live in is trying to address this. Look at some of the ways the federal government is trying to address this. Look at the relationship between legalization of marijuana and opioid overdoses, and legalization of marijuana and alcohol use, for that matter. So there's a lot of this there's a lot to unpack. But I think the most important thing is making intelligent decisions based on knowledge. I would encourage you to look into some of the things that we mentioned here in this cast. And as always, if you have any comments, questions, criticisms, if you want to come on and talk about your experiences or your opinions, I'd love to hear from you. More than happy to hear from you. I think you can find some contact information in the bio that accompanies these podcasts, or you can get a hold of us at adeincorp.com or 800-334-1918. Thanks for listening to this episode of the ADE Spotlight Podcast. If you would like to be a guest on one of our podcasts, or if you have an idea for a topic you'd like us to cover, please feel free to drop us a line. We'd love to hear your suggestions. If you haven't done so already, I encourage you to check out ADE Solutions, a new website from ADE. There you will find a variety of quizzes and assessments covering a whole range of behavioral health related topics, including substance use, gambling, mental health disorders, eating disorders, and the like. If you have concerns about yourself or a loved one in these areas, please access the website and check out the assessments. Or if you simply want to expand your knowledge on these topics, on the education tab on that website, we have a variety of quizzes as well as other podcasts similar to the one that you just listened to. You can find that at www.ade.solutions, or you can link to it from our corporate website, www.adeincorp.com.